Learn the correct way to put ECG leads for accurate readings in just 45 seconds. Proper electrode placement is crucial for a clear and reliable ECG recording. Start by cleaning the patient's skin with an alcohol wipe and allow it to dry. Place the electrodes on specific locations: V1 on the 4th intercostal space, right sternal border; V2 on the 4th intercostal space, left sternal border; V4 on the midclavicular line, 5th intercostal space; V3 between V2 and V4; V5 on the left anterior axillary line, horizontal to V4, and V6 on the left midaxillary line, horizontal to V4 and V5. Ensure the electrodes stick firmly by pressing down gently. Once positioned, connect the leads to the ECG machine and ensure proper signal transmission. And that's it. Follow these steps for accurate ECG leads placement. Stay tuned for more medical tips.